Hello, everybody. Welcome to the Taylor Medical Webinar Series, or as we like to call it, Taylor Tuesday. Our guest speaker tonight, will be Warren Windram. I'll get to more about his past in a few minutes just before he speaks, but he'll be speaking to us on the use of amniotic products for injuries to the musculoskeletal conditions, and we'll talk a little bit more about that too. Just wanted to say a few things about Taylor Medical, what we are. Many of you are probably Taylor Medical members watching this, but if you're not, I encourage you to look into this. What Taylor Medical is a large group purchasing organization that basically has been built by podiatry for podiatry. So we have some excellent leaders on our board, and it's really driven, many times we're left in the dust, and we felt that there was an important need for that. And basically what we can do with our numbers is to negotiate for the best products from the best companies at the best price. And what that means to you, should you utilize it, is it decreases your overhead, which I think in these days and times, we could all use that. Now, also, I always like to mention is people think, what can I get there? Well, the nice thing about it with all our vendors, and I encourage you all to look at our website to see all the vendors that we work with and the products that we have, to look at that, because we could basically get Band-Aids to exam chairs. So there's not really anything we can't get. There are a few things here and there, but most of the things that you would use in your office, we can get, and usually, for the most part, at a price-saving cost. So that's what we do on that side, to lower your budget. But Taylor Medical does something else. We are basically a group of leaders in podiatric education. And because of that, we thought that we should also provide podiatric educational topics in order to share best practices to build your practice while saving the money. And basically, we're doing right now bi-monthly lecture series on different topics, and they're handled basically, they're on the first and third Tuesday of every month. And really what we want to do is to promote podiatric physicians to be able to navigate through this complicated time of medicine as it's growing the way it is. Now, this is our website, how it looks, and you can find out about a lot of things in there. But I do want to direct your attention. We had previously had a series of lectures before this during the COVID time, where we had it every Tuesday, since people were striving for some education and weren't doing very much at home. And you can see that and last week's and this week's lecture up in the top corner under the webinar section, as you can see by the red pointed arrow. So I do encourage you to look at that, and also to go to the website to look at the various companies that we work with. I think that's very important. Now, in order to maximize your savings, and this is very important, not many companies will do this for you. In fact, there's some other companies trying to mimic this, but basically what we can do for you is to receive a personalized, with no obligation, medical supply cost analysis. And what that is basically we can take what you're using right now and compare it to apples. We'll give you that so that you're not getting a lesser product at a lesser price. But we can also show you and recommend some, as I would say, I guess, oranges. apples to oranges, where we feel that the product is good and you might want to try it in order to have additional savings. Now, you can create this cost analysis by doing a couple of things. You can either send us your current ordering format on a spreadsheet, allowing us to see the current vendor, item description, manufacturer number, and units of measure, and send that to us. Or if that's too much to do, basically you could just put together some old invoices. I would always go to your top 20 products. You don't need to see every product to understand the cost savings. So you could send the invoices and we'll work that through for you. If you're interested, you can do it through the website, or give us a call at the office where you'll speak to either Carla or Ashley concerning this. And usually the turnaround is usually pretty good. So without further ado, I'm going to introduce Dr. Windram. Dr. Windram comes to us from Florida Institute of Sports Medicine. While serving in that practice, he also is the chief of the Department of Podiatry at Memorial Regional, and he's also the fellowship director of the South Florida Foot and Ankle Fellowship. So without further ado, I'm going to turn it over to Dr. Windram to educate us I don't know if any of you are doing this, but I have been doing this for a while, and it's a great way to treat some of the things. And he'll walk you through those things. I don't want to talk over him. So Dr. Windram, go ahead and take it away.
Thank you, Stephen. Good afternoon, everybody. Great to be with you guys. Today's topic of conversation is going to be the use of amniotic injectable for treatment of lower extremity injuries or musculoskeletal disorders. And again, we're not going to limit it just to amniotic fluid. In general, there'll be some discussion about amniotic products in general. Let's get started. First, let's review some of the basic science behind an amniotic product. Either it be a liquid product, either be a dehydrated amnion product. But first of all, just a quick review of some anatomy. When we have the fortune of having a donated placenta, there's three elements of the placenta that have been extremely useful in regard to regenerative medicine. First, you have the amnion, then you have the chorion, and then you have the amniotic fluid. The amnion, as you know, represents the amniotic membrane surrounding the fetus. The chorion is more of the fibrous connective tissue part of the placenta, and then you have the amniotic fluid. So that's just a brief description of where we actually get this product from. And there's numerous labs across the country that obviously present, that process this, the placenta. And really depending on what we're doing with the amniotic product, it really depends what type of product we need. Something just with amnion, something with amnion and chorion, or just amniotic fluid. And in terms of reviewing the basic science behind the amniotic tissue, more or less in a nutshell, just remember that there's three components that we really look at in regard to what the science is behind the use of the amniotic product. The first is that it's a very potent anti-inflammatory product. That being said, the main purpose of the amniotic product, either in tissue augmentation or regenerative type medicine, we found in the use of this product in the operating room for many years that the decrease in the inflammatory process is pretty evident. And that is by way of decreasing the number of fibroblasts in the area, therefore reducing scarring and reducing wound contractures. And we all know if we go back into a surgical site a year or two later to remove hardware or whatever the case may be, we know that the the tissue is not the same as we found it initially. It's very coarse, very dense, and it's really, it's more of a protective mechanism at that point. It doesn't really have much of a function. So with the use of the amniotic product and then the fact that it does decrease inflammation, we see a lot of that in regard to operative procedures where we're not seeing that scarring. So it's pretty evident that that anti-inflammatory effect is present. And the second component science-wise is that it's a very strong growth factor attractor, either through epidermal cells or collagen precursor cells. And some of the more recent science has indicated that the exosomes, which is a kind of like a peptide that forms on the surface of the cell, is more of the product that's causing the actual attraction. So we ask ourselves all the time, like, what part of this product is producing these scientific steps? And a lot of the more recent research has been done indicates that the exosomes are doing a lot of the work as well in regard to attracting new growth cells in the area. And the third that we know, the third element of the amniotic product that is very useful in tissue regeneration and healing is angiogenesis. That's been proven with numerous studies that the introduction and the fabrication of new vessels in the area is quite important in regard to tissue healing. For years, we've been using this in the operating room through either a dehydrated type chorion product, which is again a little bit more firm, and we use it to wrap the Achilles, maybe reestablish the perineal tendon sheath, things of that sort, where we're looking for a little bit more structure. There are products on the market that are just amnion type products that are a little more flimsy. Again, ton of growth factors and a ton of the good stuff is in it as well, but not real structural. And then obviously the amniotic fluid. And the purpose of today's talk is to really, speak in terms of the fluid flow product that's been recently developed of BioLab Sciences out of Phoenix. And we're very excited about that because for years we've used these products in the operating room. And as you know, we don't get paid for using these products in the operating room. They benefit our patients, and we're happy about that. And basically that's where it ends. So I've been using amniotic products in the operating room for several years. They've only been out of several years, and they really have done really well in regard to my post-operative patients, particularly Achilles tendon repairs, perineal tendon repairs, any type of difficult wound closure. In fact, when we do our TARs, when we do our total ankle replacements, we routinely use a dehydrated amniotic product in the wound closure, and we found great results with that. We're actually doing a study at this point, and we're doing a poster board over at ACHILLES next year in regard to our findings and our technique. And it was just amazing in regard to how well the patients are healing with minimal scarring, no wound complications, no infections, and really little post-operative pain. Very happy about that, and so pretty excited about that. And we've been doing that for quite some time now in the operating room. So we're super excited that when BioLab Sciences came out with Fluid Flow, and Total Ancillary is the sole distributor of the product for the podiatric physicians in the United States, and it's, we were very happy that we were actually able to offer our patients this product in the office and get reimbursed for it. There's an actual Q code for the Fluid Flow, which is classified as an amniotic allograft. BioLab Sciences also makes membrane graft, like we were alluding to, a dehydrated type human amnion membrane graft that we have used in the operating room in the past. But again, no financial gain to us in the office with that. Obviously, we don't use that in the office. So when the product came out, when the Fluid Flow came out a little while back, it was quite exciting to us because in the previous months we were able to offer this product from other companies, but it was all cash pay, just like PRP. So I'm sure you've experienced that in your office. So pretty exciting stuff, you know. So just a little quick review of the anatomy and the science behind it. Stuff works great. Again, pretty excited about fluid flow when that hit the market, because then we could give that option to our patients in the office, and the indications that more or less they are stipulating from the company for the treatment of the fluid flow liquid allograft are very common things we see in the office: chronic plantar fasciitis, any type of tendinitis. There's been some studies in regard to osteoarthritis and interarticular injections, ligament and tendon injury, non-healing wounds that we've known for years. That's been very effective use of the amniotic products. And there's been some recent research in regard to nerve repair. So we'll get the next slide. And I mean, there's plenty of research going on. It's a new science. It's certainly a new science. However, there's a lot of research going on with this. You can see from the slide in front of you, there's been some studies in regard to the first study was pretty remarkable in regard to plantar fasciitis. Patient got better, dramatically got better from injections of that. Again, Dr. Werber in the second study has been studying this for quite a while now, this whole topic. He's a very good resource for us to touch base with in terms of any type of questions in regard to the science behind amniotic allografts. So he's done a lot of research in that, and he's doing a lot of the current research with exosomes. Another study was done by Lee in regard to in terms of repairing orthopedic tissues. Some of it was injected into joints, and there was some cartilage regeneration. And so the studies again are there. The last study, a good study on, and Zelen did that on plantar fasciitis. Again, the number of participants in the study were a little low. And we'll see within the next year or two, those studies are going to be much more robust. So the basic science is there. We understand that. There's research, active research going on with plenty of articles to support the use of the product for what we're using it for. So feel comfortable in terms of using it on your patients. Now, certainly, one of the more common things we see as podiatrists is plantar fasciitis, chronic plantar fasciitis with patients that just don't seem to get better. We advocate that you certainly use your typical conservative care routine for plantar fasciitis, whatever that may be. It varies from doctor to doctor, but pretty much, we follow pretty much the same type of conservative care. Ice, massage, anti-inflammatories, orthotics, a night splint, physical therapy, injection therapy with cortisone. And if these modalities are not very effective, consider doing something further. MRIs help. Anything that really documents what we're treating. We're not missing a stress fracture of the calcaneus. We're not missing some other anomaly. The MRI helps us to show the chronic plantar fasciitis or a partial tear of the fascia. So, exhaust the conservative modalities, maybe some diagnostic studies, an X-ray, an ultrasound, an MRI. And then normally when you're at that point, you're contemplating maybe doing some type of surgical procedure, endoscopic plantar fasciotomy, an open fasciotomy, heel spur resection. So basically, when you start thinking about that, when you get into that realm, this is where fluid flow comes really fits in really well. And studies have shown that it can be a very effective treatment modality prior to actual surgery. So you get to that point, you're talking to a patient, hey, we tried everything on you, the pain continues. MRI indicates it's only plantar fasciitis. Hey, do you want to try an amniotic injection? And certainly give the science behind it, why you're doing it, why is it working? And then certainly if that is not effective, then surgery is always an option. So I in my practice with my patients, I like to document all of that down in the record, and then and then if I need to use the product, I'll use the product. And there has been no issues with that. Again, everyone has a different treatment modality or treatment scheme for their plantar fasciitis, but I think we pretty much do the same thing. So, and when you get to that point where you start talking surgery. So, and and there's also, again, other studies. I'm all about studies and seeing what the literature shows, because I like to really provide that to my patients in regard to really a strong science behind using a product before just using it and saying, hey, it works. Doctor, why does it work? I don't know. It works. Come on, we have to be a little bit more informed than that. So that's why I do like looking at articles and a lot of the more common research that's been done on it. And again, this slide indicates more of a product that we would be using in the operating room, but the science remains the same. But in this case, they did a rat study with Achilles tendons, and it was almost a 0 rupture rate with it under stress. I mean, it's a pretty good article when with the control group who didn't have the graft, and then one that had the graft. So, and again, a different product, and we've been using this in the operating room for some time, but the science behind this is the same in regard to using the amniotic fluid. And then again, another study, amniotic tissue treatment for chronic plantar fasciosis, Achilles tendinosis. It works awesome for Achilles tendinosis, insertional Achilles tendinosis, because we all know those are horrible surgeries to do. A lot of patients don't get better after that. So this is an excellent adjunct treatment for an insertional Achilles tendinitis. Normally what I do is after I inject them, I do put them in a cam boot for about 2 weeks, and certainly no anti-inflammatory medication. So this was a pretty decent study in regard to showing that the effectiveness of the amniotic allografts in regard to the treatment of chronic plantar fasciitis and Achilles tendinosis. Also, there's been some studies in regard to, and these were more orthopedic studies, but they were mostly involved in the knee, in terms of injecting amniotic membrane and umbilical cord tissues into it on the osteoarthritic knee, and it showed that some of the earliest studies showed that there has been some rejuvenation of some cartilage in the joints. So that's pretty exciting as well. So again, a lot of this research is new, but it's there. Again, some of the more studies involved in the micronized dehydrated human amnion chorion membrane, and again, this is micronized, so you rehydrate it and inject it into the joint. And there's been some data that suggests that the intra-articular delivery has therapeutic effect in regard to osteoarthritis of the joint. So, and this again is the first study demonstrating that. So again, we're seeing it's an animal study, but it's showing that there is a lot of ongoing research in this area with positive outcomes. And certainly as time goes on, there'll be more in terms of human trials. And this is really new stuff with application of amniotic stem cells, and I don't really like to use the word stem cell, but it's more amniotic allograft in regard to repairing some distal nerve injuries, and they've been pretty successful with that as well. And you can see there was certainly another study in regard to that as well. And these are some of my sources in regard to, if you want to look up some of the sources in regard to the some of the studies we spoke about. Again, the Werber study is pretty interesting. Zellin, very particular in regard to plantar fasciitis. And so, again, sources are important. It's good to have these to reference to in the use of a new product, because I'm a very conservative physician and I need to see these things before I do anything new. And this is an interesting bulletin that came out of the APMA in June of this year. And it's very interesting because, you could read it, and certainly when a decision is made that using a biologic product is the best course of treatment, we recommend choosing a product that has an intended use, includes the pathology being treated. So, and with fluid flow, the intended use is tendinitis, plantar fasciitis, the itises. So we're using a product at this point that has the intended use for this. And this is why there's a Q code for it. So some, you know, and there are other products that may not have that indication, but this product, FluidFlow, does have this indication that it is an injectable biologic allograft, and its indications are plantar fasciitis, tendinopathy, and other soft tissue inflammatory conditions. And an interesting thing as well, they do recommend, and I'm impressed that the APMA picked this up, that they do recommend that confirmation of coverage be obtained from the third-party payer in the case when you do use this. Now, with Total Ancillary, which is the company that carries the FluidFlow, they have a very unique system which will give you the confirmation of authorization prior to the use of the product. So that's pretty reassuring. So they'll help you, like, hey, I have this insurance company, could we try getting it approved? Here are my notes, whatever's needed. And then they do the legwork to get you approved for it. Now, obviously, with any type of billing, I don't have to teach you guys about billing, but Q codes, and you know that usually goes within a CPT injection code. It can't be just billed by itself. And certainly the ICD-10 codes are important, that they actually match what you're doing. Achilles tendonitis, you know, be very specific, right, left, peroneal tendonitis, whatever you use, your plantar fasciitis. You're not putting a fracture code down. Not to say it can't be used in a fracture, but it would be more prudent to use the recommended ICD-10 codes that the company suggests that we use. So that was a pretty cool statement from the APMA. And this is how the more or less recommended dosage for the FluidFlow. Small joints, 1 cc, you know, plantar fasciitis, Achilles tendonitis, 1 to 2 cc's. Again, depending on the physician's preference and how big the patient is and how much you're injecting. And you know, 2 cc's on a regular basis in regard to intermediate and large joints. So normally I'm using 1 cc, and for plantar fasciitis, Achilles tendonitis, smaller joints. So that's more or less how it's available. It's 1 and 2 cc syringes, and then again, it's not cryopreserved. You can store it at room temperature, which is nice, and has about a 6 month to a year shelf life. So you need it, pop it off, use it. Prior to doing that, certainly I would recommend contacting Total Ancillary's pre-authorization department and let them make sure that everything is cool with the insurance before you do it. And again, coverage, you know, confirmed coverage and reimbursement data. They have that data if you ever need to see it. They have EOBs that have been paid for the use of the product, and we're mostly seeing that it's being paid for like the company's intended use: plantar fasciitis, Achilles tendonitis, acute and chronic wounds all day. That goes without saying. Muscle meniscus tears, ligament tendon sport injuries, degenerative tissue. And again, commercial coverage is highly variable, and again, that's why it's important to use the services of Total Ancillary in regard to getting it pre-approved before using it. Because we all know that, you know, many companies and many products come to our offices, hey, use it, and then we'll see what happens, and we don't want to do that. No, well, you'll know it's going to be covered prior to you injecting the patient. So, as to the best of their ability. I mean, certainly there's no guarantee, you know. However, but at that point, they're pretty much doing all they could for it to make sure that it has a really good chance of getting covered outside of Medicare with your commercial payers. And the financials, quickly just go over the financials. Again, this could vary, but the typically on 2 cc injection, you see the invoice cost of $4,000. Typically from the company's rebate, which gets passed on to you, the rebate amount, and then the net invoice cost. And you could do the math right there, and you can see if it's reimbursed at 100%, it's $4,240, and the profit to the physician is $1,840. At 100% paid, 80% paid, it's $920. And that's your profit. That's after it's paid for. So that's not a bad Q code reimbursement. You're still getting paid for your office visit and your CPT code for the injection, but it certainly beats a 50 cents or $1 J code. So, and again, if you need any more information in regard to this, certainly recommend getting on the website for totalancillary.com fluid flow, and they could schedule a webinar for you in regard to looking at more of the reimbursement and the whole process of getting the product pre-approved. So, and they also deal with skin substitutes as well, that and with the same pre-approved process. So, system works pretty well. And again, they're located out of Miami, Dallas, and Atlanta, and there's their website. So, all righty, excellent. Thank you very much for participating in this webinar. And if you have any questions, please do not hesitate to contact us. Thank you.
Thank you, Dr. Windram. I actually do have one question that I remember someone asking me about this. And they were asking, would you inject directly into the tendon?
The Achilles, I'm assuming?
Yeah, yes.
I normally, like, obviously we all know that we don't do that with cortisone. So with this, I do inject around the circumference of the tendon. I try to stay in the tendon sheath as opposed to going right into tendon, but as long as I can get pretty close to it though, because my technique is typically I'm going to protect this patient after the injection for about 2 weeks in a boot. So to answer your question, not directly into the tendon, but certainly in the surrounding peritoneum and as close to the tendon as you can get.
And do you do this with ultrasound guidance, or do you just?
It can be done. The Achilles, I normally don't need it. Sometimes the plantar fasciitis, it works a little better. But certainly I have used it on both. Yes. So whatever the physician feels comfortable with, yes, it can be done with ultrasound guided. Yes.
Okay. Well, thank you very much. That was very informative. I think it's an exciting gateway to the future. Many of the things you're talking about, where it's always a dilemma, the hard things to treat. So if there's one more thing we can put in our armamentarium to treat these things, it's fantastic.
Yes, I agree.
Well, thank you and good night.
You're welcome. Bye-bye.
Bye-bye.